Hello, assalamu alaikum, khush aamdeed, ji ayanu, goeiemorgen, ishpata, pakhair ragale, washmale, ladies and gentlemen. Welcome to Well This Morning. This is Chiza Hashmi on PTV World, of course, and I'm really hoping that you all are going to have an amazing day with me because together we begin with learning the right kind of information and knowledge that is out there in the world. Jummah Mubarak to all my lovely, lovely audiences out there, whoever is watching from more than 46 different countries in the world. I feel like it was my responsibility, it was my team's responsibility to actually aware you all along with ourselves throughout this month about breast cancer. Yes, ladies and gentlemen, this was the month of October. Now it's almost ending. And this month we call it Pinktober. As you can see right now, I'm also wearing my ribbon, which represents the awareness for breast cancer. Now, I know we have had quite some shows on it, but it's never enough to talk about it. So today I feel like to wrap up this month, sort of, I have a very perfect guest over here in the studio who will be talking about the awareness of breast cancer. But moreover, I want to ask, we've spoken about self-diagnosis, we've spoken about going to, different hospitals and facilities to get tested, but how to go about it? If we're talking about self-diagnosis, how can we do it? If we're talking about other facilities, what are the things we should be asking for and questioning for? What are the facilities available? Is it affordable for everyone out there? Because when we talk about cancer, it doesn't knock on your door thinking what background you come from. It is equal to everyone, right? So the facilities should be equal to everyone as well. Unfortunately, 1 in every 9 women in the world is sort of vulnerable to or exposed to or does eventually get breast cancer too. It is 100% curable if it is detected in the earlier stages as well. If it is later on, then it is at least treatable. So without any further ado, I think we should be beginning the conversation with this gentleman over here who happens to be the professor of surgery for IMDC and also ANTH. Actually, just a few months back, he came back to Pakistan to serve the country, of course, with all the knowledge he had been gaining from the UK as well. He happens to be Dr. Rizwan Aziz. Assalamu alaikum. Welcome to our show, sir.
Walaikum assalam. Bismillahirrahmanirrahim. Thank you very much for inviting me to the show.
It's definitely our pleasure. So, sir, you must have heard that we have been talking about breast cancer for this entire month, and we wanted to wrap this month up with you. So, to begin with, I want you to sort of talk about the prevalence or the stats of this condition in Pakistan.
I think that's very important. We need to make it public. We need to aware the public that breast cancer is actually on the rise at the moment.
Okay.
And every year, 170 to 180,000 people are reported with the breast cancer in our country.
Okay.
And I'm sure there must be a lot of unreported cases as well. So those numbers are not included in the data. And it's multifactorial disease, and I think we need to continue doing public awareness, and we need to continue doing what we are doing at the moment, especially the role of the media hands in hand with the health professionals.
Of course, definitely. And I think credits due where it's due, I have to mention over here, ANTH actually throughout this month gave out free consultations to anyone and everyone who was coming to, get diagnosed or at least, learn about breast cancer itself. So congratulations on that. You were a part of it, of course. Let me know how it went and what are some of the other plans that you guys are going to implement, especially for this.
So it went very well actually, because ANTH had this offer this month especially, and I think we'll probably extend this offer as well, that any women with the breast problem can come and have a free checkup.
That's nice.
On investigations, which include some radiological investigations, pathological investigations, we were giving 25% discount in our hospital.
Okay.
And it went very well as well actually, because after the success of this thing, we are actually starting the concept of one-stop breast clinic, which is very common in Europe and US.
One-stop breast clinic.
One-stop breast clinic is just like one window operation. So you come, you have your appointment with the surgeon, you have everything done in the same place, in the same room, and you get the diagnosis in a couple of hours, and the treatment is advised at the same time.
And how convenient must that be? Because I feel like that is one of the problems for a lot of people. So ladies and gentlemen, when we say we need to talk about awareness, it's because a major segment of our society lives in rural areas. Of course, I know the medium that I'm using right now might not reach out there, but for all the people who might understand my show today, please make sure to spread the word about this. This is something that anyone can be exposed to, and we need to be careful, or at least learn that if, God forbid, it does happen to us, how can we go about it? So first things first, you said that it's a multifactorial disease. Let's look at some of the things that might be causing this.
So So there are a lot of factors that are involved in development of breast cancer. I think there is something related to genetics, which of course we cannot change. It runs in the family. But the thing we can change is cousin marriages. That has very, very important role in breast cancers, because you know our parents, grandparents, and grand-grandparents, there was a lot of trend of cousin marriages.
It's such a cultural thing.
Yes. So we need to make public aware that cousin marriages actually can lead to different types of cancers, and breast cancer is one of them. And obesity has a role. It's one of the significant factors which we can control. Smoking has some kind of relationship with different types of cancers, which is very much controllable. Then breastfeeding is actually, apart from many other benefits, has a protective effect for the breast cancer. So breastfeeding, we should encourage our women for breast feeding, so that can be a factor to prevent breast cancer.
Well, brilliant. I think you gave out just the right kind of points that we needed to learn as well. But Dr. Saab, you told me, and it is definitely something that we need to learn, that breast cancer, it is not just limited to females or women for that matter. Wherever there is breast tissue, I think that's what we call it, because it appears in men as well. The number of appearances might be low, but they are definitely vulnerable to contracting, the breast cancer as well. Let's talk about that. Is it that common in Pakistan?
The breast cancer in males is not very common all over the world, and it's not common in Pakistan either. But yes, often on we see patients with male breast cancer. The treatment and prevention is exactly the same. Self-examination, get checked, radiological investigations, scan, needle test, and the treatment, including surgery, chemotherapy, radiation, everything is pretty much same. But the percentage I have said is very, very low in Pakistan in male patients having breast cancer. But if you develop a lump, or if you notice a lump in the breast being a male, it's always better to get it checked.
All right. Well, while you said that, of course, self-diagnosis is one of the first steps to at least learning where we stand in terms of it, or God forbid if we can have it or not, there is still, it's 2021, yes, but there is still a sort of a taboo attached to it, or it's a little stigmatized to talk over here, even with your family members. Now, we belong to, alhamdulillah, we can say we belong to the privileged segments of the society, or live in the federal capital where this conversation is common. But in other parts of the country, it's not. How can we get over this taboo?
I think I would just talk a little bit about this. I think this was the same thing which we were talking about previously. There's a bit of social taboo in this. I think, although there's a lot of work being done, but there is still miles to go ahead, especially in the rural areas. And the thing is, we need to encourage, number one, our women, if they notice anything, to come up and speak. I think a lot of cases we see in our practice, women just mention that, oh, I noticed a lump like 6 months ago, but I didn't mention it to anyone. And by the time they come, it's already advanced. The other thing, very important thing, is we need to educate our men as well.
Of course.
That they should encourage the women, they should bring them to the hospital as soon as they notice anything, or as soon as the women tell them anything, and they need to take the lead on this, basically. And women also need to take a lead on this. It's their body, and they need to be responsible for that, and they need to come up immediately as they notice anything.
Definitely so, and I think we have to mention, or rather commend the efforts of PTI itself, but then the presidency too, because I know that for about 3 years now, every year when October starts, there are so many campaigns and seminars all over the country, but especially at the President's House too, because Dr. Arif Alvi really wants to advocate for good health. And then the First Lady speaks about it as well, continuously awareing the general public, because definitely if these are the kind of messages we start to give out on TV for that matter, or traditional media for that matter, or they come out of the mouth of such politicians, they will have an impact. But what are some of the other ways you think we can spread this awareness?
I think nowadays media and electronic media and social media and print media as well. I mean, there are places where print media is still in place and people like to read the newspapers. I think these are the modalities. They are improved in last few years a lot. And I think media has played a tremendous role in all the health and awareness campaigns, including the breast cancer campaign. So I think we need to work more. The health professionals need to work more in hand in hand with the social media people and electronic media people, so that we can propagate the message everywhere in the country, especially in the rural areas.
Definitely, and the right kind of message. We
And
all
the right
need to
kind
be
of
on the
message,
same page
exactly.
as well. Definitely. Now, one more thing. So, if we are talking about awareness and the right kind of information does go to everyone, is it affordable for everyone actually? Because the word cancer in itself, you know, the type comes later, but the word cancer in itself gives a notion to a lot of people that it's so expensive we cannot afford to get it treated, God forbid. And I don't really want anyone to feel that way. First of all, to have a disease and then to feel we can't afford to treat it. So please let us know what are the options for everyone out there.
So I think we need to change that concept.
Yeah.
Number one is that cancer is not nowadays that kind of a disease which make people afraid of coming to the hospital or seeking medical advice. It's pretty much treatable now, especially as you mentioned earlier. It's if we catch breast cancer in stage 1 and 2, it's nearly 100%. They say 99%, but I've seen in my practice it's nearly 100% treatable.
Oh.
Stage 3 and 4, yes, we can still give better quality of life to the patients, and it's still treatable to some extent. But early diagnosis is very important in this. Affordability, yes, I think it's very much affordable because just like in our hospital, we were offering free consultations. We were offering discount on the investigations. I think there are many other hospitals who are doing the same thing. And there are many other hospitals in public sector who are providing all these facilities free of cost as well. So I think, and especially a hospital like mine, and I'm sure other hospital as well, if someone comes with a poor background, low socioeconomic background, we offer them different services at less cost or free of cost.
Well, that's good news, of course, because we want everyone to have the same facilities now. Dr. Saab, does it ever, like you mentioned that at stage 1 and 2, definitely it is treatable to a very large extent, but does it at some point get morbid as well? I mean, fatal to a level where you cannot treat it and might eventually, you know, be so dangerous.
Stage 4, I would say, when it extends to the other organs of the body, like if it spreads to the lungs, to the liver, and to the bone, that is the most common other organs affected by the breast cancer. If it spreads to these organs, then yes, it's not very much treatable. But in that case, what we can do is we can treat the patient in a way to give the patient better quality of life.
Right. So my next question definitely was that in case you do get to stage 4, and then because it doesn't just stay to breast cancer anymore, like Dr. Saab mentioned, it spreads to other part of the body as well. So is palliative care an option in Pakistan? Is it a common thing to practice over here?
It is available in Pakistan in good centers. It's not very, I would say it's not very common in the rural areas or small centers, but yes, it is available in many of the centers in Pakistan. And they ensure that patient remains pain-free, patient gets better quality of life, and whatever the life is left, patient doesn't spend in misery.
Okay, well, that's a good thing, of course. That's good news for a lot of people out there, because I do remember doing the show on palliative care, and then after that, I received a lot of, well, suggestions, rather feedback from you guys saying that such facilities do not exist here. And some of you even wanted to sort of volunteer or intern at such facilities. So it's good news. If you do look up, there are definitely such facilities, especially in Islamabad, I'm sure. But one thing towards the end, for my better understanding again, when we talk about cancers, or when it comes to the treatment eventually, where maybe it can be surgical at times, then there's definitely a sort of a differentiation if you're going to an oncologist surgeon or a general surgeon or something. I want you to sort of explain it better to people, to if they should actually go to a specialist for that particular thing, or a general surgeon is okay.
I think that's a very good question. I'm very much, I would very much advocate that people should actually go to the right person. Surgical oncology is something which has evolved in last few years, and it's evolving at the moment. It's a bit different from normal surgery, because surgical oncologist has to take care for few things, and that includes, like, we have to make sure that we take the clear margins, we should not let it spread, and we should make sure that we don't do something which can affect the quality of life of the patient. And these are specially trained surgeons to deal with the cancer patients. So I think if you have the opportunity, you should find a surgical oncologist and go to the right person to get it treated.
Well, definitely, and I think we on this particular show have advocated about it so many times of going to the specialist for whatever you're going through. Of course, there are, well, doctors in general, when you talk about MBBS, they have generally learned everything, but when you talk about specialization, that is just another level and just another field. So if, God forbid, anyone around you needs to know this, make sure to aware them and tell them that they need to go see an oncologist for any sort of cancer, first of all. Now, I have to mention over here that we've been talking about self-diagnosis, all the facilities available as well, but at what point one might think, I need to self-diagnose, I need to go stand in front of the mirror, I need to go in my washroom and check myself if there's something wrong, or I need to go see a doctor to see if something's wrong. Should we be waiting for some symptoms, Dr. Saab? If yes, what the symptoms might be?
I would say no. I think every woman between the age of 18 to 40, they should do self-examination every month.
Regardless of the
regardless
symptoms.
of any symptoms.
Okay.
And as soon as they notice any symptom like lump in the breast or discharge from the nipple or lump in the armpit, they need to go and ask for the advice.
Okay.
Any woman more than 40, they need to go and get their mammography every year, ideally. Because that's one of the screening method we use nowadays, and again the purpose is to detect the cancer at early stages. So mammography is very good in the way that it can actually detect the lumps which you cannot palpate physically.
All right.
So as soon as it's detected, we can treat it as a stage 1.
All right, and that's brilliant. One more thing again, I have so many questions about this, I'm so sorry. But recently we were in conversation with another, of course, a practitioner, sorry for the slip of tongue, who told us that being exposed to one X-ray for, of course, you know, diagnosis is actually harmful in a way that the radiations are so intense as compared to, well, if we can compare, we could say you're getting 12 checkups for that matter, or 12 X-rays for that matter. So when you think about that, and when you think about yourself, you don't want to expose yourself to so many radiations. Is there another option, and is it true, first of all? Is it that harmful?
So I would put it that way, that mammography, yes, you do every year after the age of 40. Yes, there is a bit of risk of radiation, but the mammography use a very low dose of radiation. It's very low dose of radiation which patient is exposed in comparison to CT scan or other type of scans or investigations. The benefit we get out of this weighs more than the risk we leave the patient with the cancer.
Okay, so you're saying it's not that you won't call it harmful.
I won't call it harmful, because if we risk versus, if we talk about risk versus benefits, of course the benefit is much higher.
Higher. Well, thank you so much, Dr. Rizwan, for being with us and giving us all this kind of information, especially early in the morning, because I know, especially in morning, it's so hard to talk about something so serious. But I want you to end up this segment with a public message. This is your camera. Please go speak to the people and tell them to go get diagnosed, or at least be aware.
I think I would again stress on the same thing which has been talked about all through the month of October, that self-examination is the key to to beat the disease. Basically, self-examination. Women need to come up. Women need to come up and speak. We need to break that social taboo. The men need to take these type of complaints very seriously, and if something happens, they need to ask for and seek for medical advice. There are centers available which can help you in this type of circumstances, and there are many centers who have a multidisciplinary approach available. They have surgical oncologists, medical oncologists, physicians, pathologists, radiologists, all available under one roof. Because I'm working at one of those type of centers at Dr. Akbar Niazi Teaching Hospital, and I'm sure there must be many more in the country, in every province, in every district. But my message is, don't ignore any lump in the breast, don't ignore any nipple discharge, don't ignore any skin discoloration. As soon as you notice it, you come for the advice.
Thank you so much for that message, and I really hope it stays with a lot of people out there.
Inshallah.
Thank you for your services as well. Well, ladies and gentlemen, this was our part on behalf of WAL this morning. I want to say I do feel proud that we sort of did justice to raising awareness about breast cancer, because throughout this month we have been talking about it. Special credit goes to our producer Jamshed Saab over here, who made sure to talk about it every now and then, again and again, as much awareness as we can create. Till the next time, make sure to write to us on all our social media pages with the name of World This Morning. It is on your TV screens right now, and I'll see you on Monday, inshallah. Till the next time, take care. Good morning.